Hi, hello friends, welcome to World Explorer India. Today let us discuss about diarrhea. Diarrhea is abnormally high fluid content in the stools. It will happen very common in children as well as adults. When we consider diarrhea is when bowel movements are ranging from more than 4 or 5, and it can be up to 20 times a day. That means a person is having more than 5 times up to 20 times, it can be considered as a diarrhea. Diarrhea can be very acute or it can be chronic. Diarrhea is the most common complication of diarrhea is the dehydration. So whenever there is diarrhea, it is better for us to replace the liquids as well as the electrolytes which is lost during the loose motions, then because of which we are going to give ORS and electrolytes to the patients. So diarrhea is very common in small children, usually the children of less than 3 years or 5 years. The common causative organisms are include Clostridium difficile and E. coli. So and even there may be malabsorption syndrome in the children. So whenever there is such incidences of diarrhea, one thing what we have to understand is whenever there is a vomiting or whenever there is a diarrhea, there is a loss of electrolytes, especially the potassium. So it is very much essential to replace the potassium supplements as well as the electrolytes. So we are giving the ORS, and also we recommend the patients with diarrhea to take coconut water as well as the foods which contain potassium. So coconut water is highly recommended when there is diarrhea for the patients. And whenever you face such situations, you have to give ORS, that is oral rehydration solution, and also antibiotics are prescribed, or some of the times antiparasitic agents also can be given. Apart from this, the probiotics like lactobacillus is found to be very effective to reduce the spread of rotavirus, and encourage proper hygiene and food preparation to prevent spread and future infections. Whenever we are giving water to such patients, water should be boiled for at least 1 minute if contamination is suspected in the water. Monitor children, and they may require hospitalization if there is a severity of more than 5 to 10 episodes. Hospitalization, why the children is needed is they may need the intravenous hydration. So these are all the things which we should keep in mind. And apart from this, the stool patterns may vary in the children. For example, breastfeed children may have up to 5 to 6 stools per day. Breastfed infants with acute diarrhea should continue on the breast milk. And one more thing what is really important which we should keep in mind is, as the child is younger, there is a high risk for severe dehydration. Severe dehydration means life threatening dehydration, and also there is nutrient malabsorption. So it is very essential for us to keep ORS in hand and replace the potassium supplements as and when needed, and better to get hospitalized for IV hydration. Do subscribe my channel. Thank you.